start with the World Health Organization definition of health. Health is a state of complete physical, mental, and social well-being, and not only the absence of disease or infirmity. So when we talk about health, we are actually talking about the well-being and quality of life. So from that point of view, a healthy city should be a city that supports and facilitates a quality of life for all people in a broad sense, from physical, mental, social, and environmental point of view. If we talk about urban planning, you know, I'm urban planner, so I like to remember that urbanism as a discipline appeared in the 19th century, very much related with hygienist need. They wanted to create clean cities to avoid the transmission of diseases. Like Paris or Barcelona, the health was guaranteed by a good sewerage system and good ventilation. But now, if we understand that health is not only the absence of disease, but a state of complete well-being, this implies a much more holistic view of the city as an urban environment as a whole. So the healthy city must incorporate elements such as air quality or noise pollution, but also lifestyle aspects, the fact that we can move around in an active way, the proximity to services, and it also should incorporate mental and social aspects related to relational spaces. So it's also important that location of the green areas, the vegetation, and activities we do become very, very much important when we talk about healthy cities. We have a lot of scientific evidence. Sometimes we are a little bit overwhelmed with scientific evidence, which shows that our health doesn't depend so much on the health system, but on the environment in which we live. Actually, 70% of the annual mortality worldwide is attributed to the development of chronic non-communicable diseases like cardiovascular, respiratory, diabetes, cancer. And a common factor in these diseases is the high prevalence of lifestyle and environmental risk factors, such as physical activity, diet, air quality. And those factors depend very, very much on the environment in which we live. So indeed, most of our health does not depend on the health system, but on the urban environment. So it's important to consider that by 2030, 80% of the European population will be living in urban environments. So I think it's essential to incorporate health into the planning of our cities. We cannot don't do that. You asked me specifically about the relationship between sport and urban environment. For a sport, let's say intense sport, the city must be well equipped and spread out. But for daily sport, which is nothing more than an active lifestyle, the city must be prepared for people to walk, cycle, or socialize. I mean, we can tell people to walk, but we should ask ourselves if the city is ready for that. Do the streets, pavements, traffic allow for a pleasant 30 minutes walk? That's the question we should ask. There are a number of, let's call it urban determinants that influence health. By urban determinants, we understand those aspects of the city planning that can be modified. So there is scientific evidence that some of these determinants directly influence some health indicators. I mean, more green space, less cardiovascular diseases, or more emotional well-being. But some other aspects influence health indirectly by modifying the environment or your behavior. For example, reducing traffic improves air quality, which will have an impact on several diseases, or improving connectivity, walkability, or cyclability will increase physical activity, which will have an impact on other health indicators. So it's important to consider the health impact of any urban intervention, but not after the intervention, as it has often been done, but beforehand. Having data to evaluate is always difficult, but we can monitor those urban determinants, such as the number and proximity of green spaces. We can monitor the walkability, the proximity to services, to see if we are on the right track. I would say that the challenge for all the cities now is incorporate the health perspective during the design and the planning phase of our cities, mainstreaming health in the urban planning and design. This is exactly what we are trying to do in our URBACT Healthy Cities Network, Healthy Cities Project, which I coordinate. Incorporate health as an element of planning. We try to plan and design with the health in mind, with the health glasses on. Besides being the coordinator of the Healthy Cities Network, I'm also an urban planner for the city of Vic. Vic is a medium small city. It's a Catalan city located in the northeast of Spain, 70 kilometers north from Barcelona. And for some years now, Vic has been trying to place health and quality of life at the center of cities policy. Health is a cross-cutting concept, so it must be approached from all policies, as stated in the World Health Organization mandate. That's why in the city, all departments are working for health. That's in Vic, we have been also the first in incorporating health into the process of drafting a master plan. In addition, together with the University of Vic, we're a small city, but we have a university, which is very nice and it's very helpful in all this planning process. And together with the university, we develop a methodology to evaluate the impact on health of the planning proposals. The master plan is like the main document that outlines the city of the future. It determines where the city will grow, where will be the new green areas, or where to locate a new school. It also determines aspects such as zoning or uses. So this creates the scenario, the environment, a city model, which will influence the lifestyle and health of inhabitants. It's just be aware that the relationship exists between urban planning and health, so it's much better to use it as a tool, incorporate this health perspective during the design, incorporate as an opportunity rather than ignore it. Well, I think the very first step is to understand the cross-cutting nature of this issue. You don't get a healthy city just by involving the health department. You need coordination between all departments. I mean, the sports departments need to be in a very close relationship with the environment departments, which are in charge of the parks and green areas, and also the mobility department. And the planning of the city must be in line with all those policies from the different departments. For example, lifestyle also depends on our streets, public spaces or green areas, but also on the uses and zoning of our environment. We know that mixticity is good, mixed and diverse neighborhoods with spaces for living, working and socializing provide a better quality of life than monofunctional neighborhoods. So it's important that all the policies in the municipality be aligned in the same direction. So create awareness in the all departments. And another key aspects, even more important, let's say, it's the incorporation of citizens, of course, in the urban planning process. At the end of the day, all this is about putting people at the center of the policies, of the urban policies. So community involvement is essential and necessary. And finally, also involve the health sector in urban design. We should understand that the city can become itself a health tool. The health sector can use the city to prescribe walks, activities, or sport. So, but that's why it's important that the city to be designed for this purpose, to follow what the health sector needs.